A lot of times we talk about habits and lifestyle when we refer to prostate cancer survivorship. I'd like to hear from both of you. What are your thoughts and recommendations? And, what are a good start? What are some things that people can do who are watching right now to improve prostate cancer survivorship in their own personal habits and lifestyle?
Dr. Mensah?
Absolutely. I would say things that we can do at home would be one, cutting out what I like to call crap. That's your candies, that's your refined sugars, that's the foods that we know that we are allergic to. Those are your processed foods. Another thing that we can do are strategies with our exercise. So oftentimes I think when we want to be a gym goer or we're trying to get into physical fitness or shape, we think we have to hit the gym and the weights super, super heavy, which isn't the case. There's more data to show it's the consistency, so the regular regimen that you have daily in practice that is more suited for prostate health than just intensity.
Yeah. So I think what he's saying is super simple. And if I could even simplify that further, if you are eating candy, then that's a good place to start, perhaps eating less candy. If you are eating fast food, maybe making a conscious effort to cut it down to once a week or twice a week. It starts with small steps, and it may feel like, well, is that enough? You may not think it's enough, but your body is going to perceive it as a way of lowering inflammation in your system. So the whole purpose of changing our nutrition or changing our exercise or changing our lifestyle is to lower inflammation in the system. Inflammation is like a car alarm that's constantly going off, and it changes the way that cancer cells are able to use fat and sugar. And so by just cutting out candy or reducing your dependence on fast food, you are actually making significant steps towards better health. So I love those things. I love those few things. And I would add that the data on the whole shows us a couple things, Dr. Lutz. One is to aim for eating more plants. So if you're eating steak, fine, you're eating steak. I don't love it, but I like it, right? If you can make half your plate, 3/4 of your plate, a vegetable along with that steak, instead of it being a side dish, instead make it more of a main dish, that can make a huge difference. Using a smaller plate can make a huge difference. So eating not eating as much and eating mostly whole foods. So if you're going to eat a steak, let's make it a grass-fed, grass-finished piece of meat and not something that you're buying from Burger King or Arby's, wherever you
Or whoever you're promoting or not. But one thing I tell a lot of patients is they, I tell them that carbs are not the end of you, but the high glycemic carbs are. Mm-hmm. And I tell them to go and look up the glycemic index and start with things that try and find carbs that you like or enjoy that are lowest on the glycemic index that don't get those insulin surges. And that's usually my discussion I have with most patients, so that they still get that enjoyment of a carb, because carbs are addictive, as we all know. And, we don't want to, promote eating, boxes of candy, but we do want people to still enjoy a balanced nutrition, balanced quality of life.
Absolutely. Yes. And go ahead.
No, you go ahead.
Oh, and just to tie those 2 points with eating vegetables and monitoring our carbs, I agree 100%, Dr. Lutz. Like, carbs are not the enemy. In fact, vegetables have carbs, our whole grains have carbs, our beans and legumes have carbs, which are completely healthy for us and important in balancing our diet, and not just prostate treatment, but also survivorship as well.
Yeah, we don't believe there's no such thing as a bad food or a good food, really, as long as it's a whole food. Bananas don't cause cancer. Rice doesn't cause cancer. How developing a different relationship with food is the ways that we can transform things. So it's actually, I think, hard on patients to hear there is such a thing as a bad food. No disrespect, Mike. I mean, Dr. Lutz.
I got you. No, I'm good. So,